This conference will now be recorded.
Excellent, thank you. So I hope you've all had a good week. Hopefully you can see my screen. This is the 10th. It's astonishing how quickly the 10 weeks have gone by. The 10th week of doing these weekly updates on the COVID WhatsApp group sharing. And about the rest of you, my hair is beginning to grow long. It's actually started going sideways out of the side of my head. So as well as growing long down the back, just not growing on the top. I don't know whether anyone else is experiencing those sorts of challenges, but I guess compared to the challenges that other people have had to experience over the last 3 months, it's a small price to pay. So we always start these webinars with this slide, which shows a summary of the COVID WhatsApp group. And even though we're sort of past what feels like the first peak, and hopefully there won't be more peaks to come, but who knows, this group is continuing to grow, and we've got 60 countries, 363 organizations, and 630 people now involved in this community, which is something to celebrate. We always start with an infographic, and this is the one from this week. I suspect that not many people on this call will be able to read Arabic, but Google Translate's been incredibly useful here. And basically this graphic is based on the results of a survey that was done in the Middle East. And it showed that innovation increases with the amount of time that employees spend outside the workplace. So if we're looking for something to celebrate over the last 3 months, that must surely be something there. If we now come to, as you know, if you've been on these groups before, you'll know that there's been various WhatsApp subgroups that have been created around technology, SARS-CoV-2 in wastewater, wash service affordability, and communications. The communications group, which was kindly sort of being coordinated by Neil Dott from Aquafed, was only set up about 10 days ago, and so it's got less members in it. But what I'd like to do before I get into the main bulk of this webinar is just share with you very quickly the key topics that are being covered under each of those groups. So for the technology solutions group, there's been a lot of talk about the viability of test technologies for SARS-CoV-2 RNA, and whether they could be done on site and in the network versus doing something in the laboratory. And if you were on last week's webinar, you'll know we talked a little bit about that with KWR. There's also the Technology Scan project, which was the Horizon Scan project, looking at what technologies might be out there to help us through pandemics like this. And that project was started about a month ago and will complete in about a month's time. And we've seen something like 100 useful technologies have been identified so far. And the suggestion, which is obviously subject to the funding members agreeing, is that group, is that the findings from that group could be shared with this wider group, at least the headlines from it. The second subgroup to give you an overview on is the wastewater subgroup. And not surprisingly, this is all about wastewater-based epidemiology, or WBE, which we'll talk about a bit more in the main part of this webinar. But the conversations here have all been around, can this lead to a proper tool for doing early detection, with also us touching on the South African National WBE program, which is building on past experience that they've had with other pandemics, such as polio. And you'll see on the right-hand side, there's that blue box, and it lists a bunch of countries. And there's a whole raft of different international activities going on, which, again, I'll touch on a bit later. You'll also spot at the bottom of this slide, there's a note around COVID-19 is the disease, SARS-CoV-2 is the virus. And for the purists amongst you, you'll no doubt have had people saying, yes, and the COVID-19 has to be in capitals. So it's just one to keep in mind. The third group is on wash services affordability, WASH standing for water and sanitation and hygiene. And this group has been focused a lot around talking through the impact on some of the poorer people in society, and I'll pluck out a few key threads from that in a minute. And then we come to the fourth group, which is on the comms group. As I said earlier, it was a new group, but there's some great stuff that's been shared here around some ministerial dialogue that came from some developing countries who were responding to to some fairly pertinent questions that came from an audience, and I will touch on those a bit later. If you flick to the blue box on the side, there's Donald Trump's letter to the World Health Organization that was sent a couple of weeks ago. It's only 5 pages long, and it is worth reading because it's one of those documents that no matter what your politics are, I think you'll see it as this is a historic document. It's one where there's a pivot point that things are going to be different going forward because of the implications of that letter. So if you've not seen it, it's worth clicking on the link when I circulate these slides at the end. So here's the agenda for today. We've got the highlights of the week. There's 6 or 7 of them there, and I'll gallop through all of them relatively quickly. And then I'm going to take a few minutes to talk about the Water Action Platform, which is the proposal as to what this group might evolve into. And then we're going to finish with an interview with Laura from Acquabrascian. I always struggle. My Italian's not very good. Who will talk? Laura's going to share with us her experiences and the things they've done around water safety plans. And we'll finish with that. So let's jump into the highlights for the week. Last week, under the WASH title, I talked a bit about how were we slowing the spread of COVID-19 in slums. And you'll see the first top part of this slide, I've actually pasted a summary of some of the things we talked about last week. On the bottom, there's a new case study which has come from Uganda. And the first bit of it is very similar to the stories we've seen before. In particular, collections, the revenue that's coming in has dropped dramatically by 40% in just the space of a few short weeks. The bit that stands out as interesting here is that bottom bullet point. And that's, there's been a rise in non-revenue water, and it comes from 3 things, basically. It comes from illegal use, and that's because the water loss protection teams aren't out on the streets for obvious health and safety reasons. It also comes from the fact that meters have not been replaced, partly because the meter replacement team aren't out there doing that work, but also because clients are reluctant to have visitors come in, and that means that meters are beginning to drift, they're not being calibrated, so you see an increase in non-revenue water. And the third thing is that there's the network that they've got in Uganda is not as flexible as it would like, which means that there's more bursts happening. And of course, for obvious reasons, there's a restriction in the amount of time that it takes for people to get to fix those leaks. Now, this concept of, hang on a minute, the COVID-19, one of the consequences is leading to an increase in leakage and non-revenue water. I hadn't seen that being shared in other case studies, or if it has been shared, it's passed me by. And I thought that was a useful thing to flag up to see, is anyone else experiencing that similar picture? Staying with the WASH side of things, there's a slide now on the WASH and vulnerable communities. And as the developed world is now, in general, getting over the peak of this pandemic, I think we're still to see the worst of it hit some of the megacity slums. And there's lots of things that are being done by very well-meaning and very well-resourced organizations to try and address those problems. And rather than with the sort of almost blasé statements of we need to raise the importance of WASH on the political agenda, I wanted to see if there were things that we could share that were more specific and more direct. And the World Resources Institute has published an article on combating the coronavirus when you don't have clean water. And it flags up some genuine, real, very simple solutions that could be done. So if you look down that bit that's in orange, halfway down the slide, they made the point that in Rwanda, only 5% of the population has access to hand washing facilities, which have soap and water. And clearly, to ask a community to protect themselves from the virus when they live on top of each other and they don't have access to clean water is nonsense. So what they've done in the city of Kigali, which obviously is in Rwanda, they've installed portable hand washing stations at places like bus stops and restaurants and taxi queues and in car parks. A really simple, low-cost solution enables an impact to be made, a real impact being made to some of the most needy people. Moving on to the third thing to cover off was around maintaining and restoring water quality in buildings. So this question was raised in this last week, but actually had also been raised in previous weeks. So about a month ago, we'd seen this question had come up, and I've actually pasted the question and the answer that came up about a month ago when this question was raised. And why is it relevant? Well, it's relevant because, of course, people are now returning to their offices, and as highlighted in orange here, the optimum growth conditions for undesirable pathogens such as Legionella occur when you have when buildings are left with their heating systems not properly maintained. So there was a question around, well, what should we do? And I don't intend to read this slide, but when you get the slide deck, if this is an issue for you, you'll see that there's we've got 2 slides here which give a checklist of these are the things that building owners should do to maintain their water supply and make sure it's safe when they reopen their buildings. Moving now to the transmission via sewage. So if you've been a regular on these webinars, you'll be aware that the recurring message has been sewage is not a vector for this virus. It's not a high risk vector for this virus. Once the virus hits the sewage, it essentially gets deactivated and the RNA is present, but it's not a problem. There is now a slight shift in that viewpoint. So I must stress that, as it says on that second paragraph, the authors of this particular paper note that there is no robust evidence yet for the coronavirus being directly transmitted by the fecal-oral route. But because we're now getting an increased viral load just generally in the environment, there will be an increased risk of there being transmission. And in particular, that transmission risk will increase where there is the potential for the virus to be put into the air, where it becomes aerosolized, which would be in pumping stations or such like. I think we actually talked about maybe last week or the week before about the need to make sure that people, when they flush the toilets, they actually put the lid down. Just to reduce the number of viral issues. Sticking with the wastewater-based side of things, we shared last week around what was going on around wastewater-based epidemiology and what was happening where, and I sort of made the comments around the things that are going on in Australia, in America, in South Africa, in Europe, and in the UK. And I've summarized that. It's a repeat from last week. At the top half of this slide, and at the bottom, there's some new information which comes from Acciona in Valencia. Now, Acciona has done an interesting thing here in that they're doing a detailed study within their network with 24 control points. But the point here is that it's within the network. It's not at the front of the sewage works, not at the head of the sewage works. So we're going to get a different picture there, which will tell us different things. Now, here's a really interesting slide that was published in a webinar that KWR did yesterday, and it just shows a map of the institutions around the world which are doing things around WBE. And you can see that this is a global effort. And the bit I love here is that there appears to be genuine, true sharing and knowledge transfer between these different institutions. There's obviously a bit of competitive edge, but there's generally an open heart to do things. Now, the value here, of course, is that because we're talking about a biological system, it's going to have temperature is going to have an effect. So seasonality will have an effect. And that's why having institutions that are in the southern hemisphere talking to institutions that are in the northern hemisphere gives us that ability to look at different seasonality effects very quickly. We don't have to run for a year because we can look at what's happening in Australia in winter and what's happening in summer in North America, and we can make some informed decisions, some informed viewpoints off that. It's worth noting that the Scientific Publication Committee has also focused on this, and Water Science and Technology, which is one of my, I regard one of the best scientific journals in the water sector. They are calling for papers. Sorry, Megan, I've got a little bit of feedback. Can you just help me there with, thank you, I think you put that person on mute. They've got a call for papers that are specifically around COVID-19. There's a couple of months before they're due, and we've listed here the topics that might be of interest. So you can see it does cover everything. It covers things to do with WBE, but it also includes issues like, have you seen increased sewer clogging because people are flushing their masks and their paper gloves and their wipes and everything else down the sewer, and is that causing a problem? So I encourage you to use that paper. At the beginning, I made a comment around the comms group and some ministerial dialogue that had come through. And Neil Dott shared, he sat in on this event where they had water ministers from Nigeria, Ethiopia, Ghana, Pakistan, and Indonesia. at an event that was organized by the UN Sanitation and Water for All Partnership. And there were two questions that were raised that were particularly pertinent. So the first question was, during the COVID crisis, what steps can be taken in the short term to ensure service continuity to all residents? And by all residents, that means those that live in formal settlements and those that live in informal ones, slums and shantytowns. And you can see the responses here. They're very informed. It's good to see that the politicians are well informed. They know the issues. And a lot of these points could be transferred very reasonably to a developed country situation. You know, work with your supply chains to make sure that the chemical equipment is active and present and available. The second question was the one that particularly struck a chord with me, because it was the same question during the COVID crisis: what steps can be taken in the short term too? But it was the next bit that was different. And it was, what steps can be taken in the short term to ensure the financial stability of the utilities? And of course, in developing countries where the population is less affluent, that is a particular issue. Now, if you look at that top bullet point, it says the answer that came back was try to wean customers away from the universal tariff freezes or providing free water for everyone as soon as possible. It isn't even a medium-term solution. It is a short-term solution, but it's an incredibly dangerous one. And instead, the second bullet point here, instead focus on social tariffs and target them as much as you can to the right groups of customers. Now, the reason I raise this is you might recall that last week we talked about this, water shutoff moratoriums. And I've summarized last week's discussion on one slide. But we had two sides to this argument. We had one from the Center for Water Security and Cooperation that was basically saying, not enough is being done to ensure that everybody in society has water. And then the other side of this was some examples from Colombia, the USA, and Mexico, where you have utilities saying, well, hang on a minute, this is killing us. We're being crucified. We are losing out on our revenues, and we're not going to be sustainable businesses. 14 billion is expected to be lost from US utilities. And Colombia sort of highlighted the issue in particular, and that they said, well, the world falls into three types of clients, three types of customers. You've got those customers that are so poor that they can't pay, and they therefore obviously need support. You've got those customers who are affluent enough to pay their bill and will do, and that's great. And then you've got this group of customers in the middle who can pay but won't pay because they can see that they now don't need to. They're being let off. And that's the bit that's causing enormous problems. And so it was very useful to see that issue, where all our hearts were 2 months ago as this issue came, was, okay, let's make sure that we get water to everybody that needs it. And we now need to move very quickly to much more targeted programs that make sure that the social tariff is delivered to the people that most need it, but not delivered to the people who don't need it. The last thing of these highlights to talk about is, what are the opportunities in a post-COVID world? And here we've got a summary from the Global Water Summit's Corporate Leaders, Water Leaders panel, which took place last week. And it had various people from a number of utilities: DuPont, Aqualia, Acciona, Stantec Suez, and XPV. And the audience were asked, the panelists were asked some questions around what they thought would happen to the water industry. And there are 3 points here that I think are relevant, and that are highlighted in the bullet points in the middle. The first one is that COVID-19 has raised the profile of the water industry in a good way. We as an industry have been seen to be robust and resilient and responsive and providing the backbone to society. That means that people don't have to worry about that part of the infrastructure. The second one is that the COVID-19 crisis is going to speed up the adoption of digital technology. There's been years when water utilities around the world have all talked about their digitization plans, and some have been very effective in adopting them. But this pandemic has really shone a light on those utilities that have the ability to go autonomous quicker than others. And then the third point was that there's going to be a broader acceptance of new forms of business and client management. That shift to having staff that can work from home, allowing them to work from home, having that cultural shift where organizations trust their staff to work from home in a way that they maybe wouldn't have done a year or so ago. So those are the highlights from this last week. I'd now like to just talk to you a little bit about what's happening with the COVID WhatsApp group and how we're going to evolve it. So the first thing to say is this group is incredible. We've created this unique global network of organizations that just want to share their experiences and want to learn from one another. And we've learned a few things on the way. We've learned that WhatsApp is an incredibly effective communications tool. It's endemic everywhere, and it's incredibly easy to use. The downside is that WhatsApp becomes chaotic incredibly quickly. Once you get more than half a dozen people on a group, it can become quite difficult to follow the threads. And that's what we and ISLE have done. We've tried to tease out the key learnings and then share them in webinars like this. We've also learned that some questions need specific resources put to them. You might remember about 6 weeks ago, a question came up around, well, what were they doing in Sweden, where they weren't apparently in lockdown? And there was some of our American utilities asked us the question, can you find out what's happening in Sweden? We were able to do a targeted question to half a dozen utilities in Sweden and come back with a detailed response on that. We've also had to expand into subgroups, as I've talked about, and we've learned also that sometimes WhatsApp isn't the right forum and that you need to do things by email. And the board paper that came from Wastewater that then was shared with 52 utilities around the world was a perfect forum that shows that sometimes WhatsApp not quite the right answer. And we think that this forum has worked because it's obviously relevant, but it's open, it's fast, and it's informative. And I hope you found it useful. What we're going to do over the next couple of weeks is we're going to evolve this into something called the Water Action Platform. And this new platform is going to be open to everyone, just as the WhatsApp groups are now, and it's going to be free, just as the WhatsApp groups are now. Its core goal will be to facilitate collaboration and sharing amongst the groups with a strong innovation theme running through it. And what we're going to do is we're going to continue with the WhatsApp groups that we've currently got. The frequency of these webinars might drop down over the next few weeks because, as we come through the sort of heat of the moment, it might not be relevant to do this particular forum weekly. But we're also going to create new groups around topics that are of interest to this group, but not necessarily related to COVID-19. And I'm going to share with you some of those topics in a minute so that you can see whether you want to be part of them. What we and ISLE will do is we will continue to try and sort the chaos that comes from the WhatsApp groups and drive out the gems of wisdom. And we're going to set up a web page that we will be able to direct you to, where there will be case studies and podcasts and interviews and documents that are needed. And what we're trying to do is create this platform that enables you to be able to get to the information you need quickly and efficiently without necessarily having to wade through 6 documents, each of 50 pages long. You can get to the right information quickly. What we'll also do is, as required, we'll do monthly webinars a bit like this, where in the space of 10, 15, 20 minutes, I will try and summarize the key points that have come from all of those groups. So we'll try and keep that cadence of engagement without it hopefully sucking up too much of your time. How's this group going to be funded? Well, the Water Action Platform will be sponsored by organizations who share the belief that collaboration and open sharing will make the world a better place. We've got a very broad church that we're talking to here, ranging from IFIs to utilities to academics to corporations and consultants and investors. And you can see here we've already had a good response from half a dozen or so organizations that are listed here. It would be great to have more support. And if you're interested, if you think your organization would be interested in helping to sponsor this and be help ensure that this platform exists, please don't hesitate to drop me an email. I'd love to be able to talk to you about that. I think it's worth just finishing with a reminder of why we're doing this. And when you see this slide deck, I encourage you to click on the link here. It's basically a 2-minute interview that we did with Sarah McMaster. She's the chief executive of Mosul, the market operator in the UK. And she caught the virus, and it basically took her out for 6 weeks. And it's a pertinent reminder of why this forum is important. As always, there's a list of unanswered questions that are there. There's also lots of resources available, the usual list of go-to resources for you to link to. And then our next steps. As I've said, if you want to develop any of these above topics, or you want to engage on any of the Water Action Platform forums, there's a list of the ones that we're looking to explore. Next week, we will have another one of these forums in a week's time at the usual time. But what I'm going to do is that we're going to add in a summary of what we've learned so far. What have the last 12 weeks taught us, and what are the headlines that have come out of this, to make that useful? Now, what I'd like to do is I'm now going to take myself off sharing the screen, and I'm going to ask Laura Mostarda whether she'd be kind enough to turn on her camera. I've now got so many names. Marvelous. There you are, Laura. Good to see you. Thank you very much. Okay. I can hear you perfectly. Thank you.
Great.
Laura works for Aqua Brescian, and she's very kindly agreed to take the next 10-15 minutes sharing with us her experiences and what they've done with water safety plans. Just to put this into context for everyone, as you probably remember, Italy was at the forefront of catching the virus when it came out of China. It was one of the first countries to catch it. So, Laura, thank you for your time. Can you start by just giving us a quick introduction to who you are and what you do?
Of course. First of all, I want to thank you to inviting me in this webinar, and for me it's a big pleasure to be here speaking with you. And actually I'm speaking from my living room, as you can see, and as many of you probably. And well, I'm Laura Mostarda. I'm an environmental engineer, and I work in Acque Bresciane since 2017. My job in Acque Bresciane is focused on water safety plans, and in particular, I work in the drinking water management department, and in a really positive and stimulating group to which I say hello. In 2019, I achieved the qualification of water safety plans team leader, given by our National Institute of Health. And well, another thing I can say about me is that I'm 28, and as you can see, I'm a female. I like to underline it because I'm quite proud that my company believes in young people and in women as well. So when you want, we can start.
That's brilliant. That's marvelous to hear. And thank you. And it didn't even occur to me that that would be something that needed to be celebrated. But you're right. It should be celebrated. So for those people who don't know Acque Bresciane, can you just give us a little bit of context about the size of the organization, who it serves, where it's based in the world, the geography?
Yes, of course. Okay. Acque Bresciane is a public company that manages the integrated water cycle in 93 municipalities in the province of Brescia. The province of Brescia is located in the north of Italy, in Lombardy, which is 80 kilometers far from Milan. Probably you have heard about Lombardy because unluckily it has been the Italian red area during the emergency.
The hotspot.
Yes.
Yeah. Sorry, didn't mean to interrupt.
Okay. So we manage the drinking water, but also wastewater treatment and sewerage. And the territory we manage goes from the mountains in the Prealps in the north to a wide plain, the Po Valley in the south. And it is enclosed between two famous lakes, which are the Iseo Lake in the west part and Garda Lake in the east one. Maybe you know Garda Lake because it is the largest Italian lake. And if you don't know it, I suggest to come and visit it because it deserves it. It's beautiful.
Well, so it's interesting. When your colleague this morning mentioned it, we got a whole load of chat from people saying, it's a lovely place. I've been there before. I can't wait to come back. So you're doing a beautiful advert for Northern Italy. It is a lovely place to be. So tell me, how many people do you serve?
We provide our service for more than 400,000 inhabitants and for about 87 million cubic meter per year. And the overall length of our distribution networks is about 4,000 kilometers. And due to the variety of our landscape, we manage also different types of water sources. For example, we have wells, springs, but also surface waters such as lakes and rivers. Besides, also the treatments that we need to serve potable water are different. For example, we have plants which are based just on a simple filtration to remove turbidity, but we have also complex multivariate treatment plants to treat surface waters. And moreover, Acque Bresciane is a constantly growing company. It is going to increase the number of municipalities managed every year. And it is assumed that within 2032, we'll manage all the province of Brescia, which means 1.5 million inhabitants served. And that means we will become 3 times what we are now in terms of inhabitants served.
That's an aggressive growth. So now, okay, let's talk specifically about COVID-19. So in the UK, we saw it hit Italy, we saw it then go from Italy to Spain, and we knew it was coming. We weren't even ready for it. It hit you. It was coming like a bolt out of the blue. Can you just talk me through the story of when it arrived and what you as an organization did?
Yes, of course. Well, the Italian first case appeared on the 18th of February in Codogno, in Lombardy, which is not far away from the province of Brescia. And while the first cases occurred in the province of Brescia around the 24th of February, and since the first days, Acque Bresciane started to improve some internal procedures to protect both the health of its workers and consumers. So some days the beginning of a lockdown, even if no specific rules were already set by our national government, Acque Bresciane started giving some practical instructions to all the personnel, such as stay at home in case of any respiratory disease symptoms, or keep 1 meter distance from each other, and avoid working inside the customers' houses. So during the first weeks, Acque Bresciane implemented also other important measures, such as the activation of remote working for as many employees as possible, starting from those which were affected by previous disease. And Acque Bresciane also invested in the strengthening of the remote control of our plants. So our staff really showed responsible behavior, considering the emergency quite seriously from the beginning, and I think it made the difference. So all these actions were started before the beginning of the lockdown phase. So therefore, when the lockdown was declared, we were quite ready to face it.
Yeah, and which is incredible. I mean, that's an incredible amount of foresight, and all credit to you. And I remember in the news, everyone was going, "Well, Italy's been caught without thinking," and of course, actually, time showed that you'd responded incredibly quickly, and that enormous peak that we thought was horrific actually was quite a gentle peak compared to what other countries have seen. So can you now tell me about water safety plans? The team you work in deals with the water safety plans. And just take me through some of the key learnings, the things you got right, the things you wish you'd done faster, those sorts of issues.
Yes, of course. What we learned during this emergency is the important role of water safety plans. And water safety plans were really useful in identifying some hazardous events and the related hazards, such as the possible impacts of a water service interruption on hospitals. And COVID-19 told us that a water supplier has to take into account also those hazardous events that are not directly related to the water supply chain, but that can harm its personnel health and the human resources. So due to this change in perspective caused by COVID-19, we had the opportunity to improve our water safety plans, taking into account the new hazardous events, which are related more with a change in people habits rather than our water supply chain. In addition, I can say that basically we followed the guidelines published from our National Institute of Health, and we added the dangerous events to our risk assessment metrics.
And just for everyone to know, we've shared that document has been translated into English and is shared on the OneDrive. Sorry, carry on, Laura.
Yes, thanks to the measures that we previously implemented in our company, we were already aligned with most of the requirements suggested in the guidelines of our Institute of Health. However, some aspects had to be improved. For example, some of our sampling points were located in parks or other public places which were closed due to the lockdown. So for this reason, we couldn't sample and analyze the water in those points, and we missed some analytical data. Of course, if you have a big historical database, if you miss some data, is not a big issue. But we don't know if the next time lockdown phase can last longer. So we included in our improvement plan to list all the sampling points located in those potentially inaccessible areas, and we provided alternative points in order to avoid a lack of information about our water quality.
Yeah. Now, we've actually had a couple of questions that have come up. They've both been sent to me in private, and so I won't name the people that have shared them. But if I can just share these two questions. So one is they basically said they'd like to ask a question around the emergency planning for COVID and what you do when it overlaps another natural disaster, such as a hurricane or a flood or a tornado. Now, I'm guessing you haven't had hurricanes, floods, or tornadoes in northern Italy, but you may have had a drought. Did that impact you? Have you had to deal with sort of multiple layers of emergencies?
No, we didn't have a drought till now, and I hope we'll.
All right, well, that's good.
Yes, in the future. But what I can see about these kind of events, which are really rare, is that we can't predict all the dangerous events that can impact to our drinking distribution system. And so what is important is that our company becomes more and more resilient, and that our emergency plan will become suitable for different sorts of risks. And as we already said, we were used to think that risks could have impacts just on our water supply chain, while now we are aware that they can have an impact also to human resources, and that they can lead also to a big lack of people. Besides, we learned how to change quickly our perspective. And if even if our water safety plans could be complete and well working, there will always be something that we couldn't predict with the data that we have now. From this point of view, I would like to share you an idea given by Nassim Taleb. Maybe you know him. He's a famous author and an expert about risk management. And he says that we don't need to prevent the next catastrophic event. So, for example, a drought. But we need to make our company become disaster resistant, and also that an anti-fragile structure doesn't refuse a crisis. It uses it to upgrade itself. Another thing okay.
Well, sorry, I think that's a point just worth pausing on here, in that you're absolutely right. This isn't about, it isn't about saying how are we going to deal with a particular crisis. It's about building into the organization enough flexibility to mean that it's robust and it can deal with whatever the punches are that come, be that a hurricane or a drought or a pandemic. It's about flexibility.
Aspect, yes.
Yeah. It is, and it's cultural. It is as much cultural as it is anything else. Now, there has been another question, which, like I say, was shared with me in private, so I don't think you can see it. But it says, how did you deal with the long shutdowns in commercial and office buildings? Did you offer flushing guidance guidelines, and has Legionella been an issue that you've
Yes,
seen?
of course. One thing we have done is also to think about the industrial areas which were closed for several days. The stagnation of water in wet pipes could have effects on the biological growth and also on Legionella. And so we activated the building, the flushing of the water distribution pipes, and we also started an information campaign directed to the industries which were going to reopen. So we recommended them to flush all the taps and for an adequate time. And we also suggest to disinfect the internal piping system if necessary.
Brilliant. Now that question came in blind, and yet you felt like you gave me a very succinct answer. I completely love that. That was so, and it wasn't prepared. So we're pushing up against time here. So I just like my last question is really one around when, if ever, do you think we'll return to normal, and what will normal look like for you? How different will it be to the old normal?
Yes, well, if you mean as normal as we were before the pandemic, I think we won't be back to that situation. We came across a dramatic event, and as we already said, through that we learned something new. So we won't be the same as February 2020, but our goal is to reach a new normal. So, as many of you, we wish to come back to our offices. We will miss working in person. But honestly, I can't say when it could happen, because it depends on many factors that are not just related to our company. For example, it depends on when a vaccine or a cure will be available, and on how the number of infected people will vary over time, and on the future decisions of our government. But what we can guarantee you is that we will do our best to be like water. I mean, water has the skill to take the same shape of its container. And so we will do. We'll try to adapt our behavior depending on what is going on around us. And so in conclusion, we hope to come back soon, but in a safe way.
Brilliant. I love that picture of it ties so neatly to your comment on resilience is about being flexible, and that image that we're in the water sector, let's be like water, let's adapt ourselves to the circumstances that befall upon us and not collapse. That's such a great message. Laura, I really thank you for taking the time and being so concise and sharing so openly your experiences. So thank you very much.
Thank you, Piers.
And Dragon Savage has shared here, will we ever get back to the old normal? And I think that's the point, is that I think that time has gone.
Okay.
So thank you, Laura.
Bye-bye.
Coming back to everybody, bye-bye. I'd like to thank you all for your time and joining us today. I hope you found it useful. In a few minutes' time, I will circulate the slide deck. Please do keep yourself safe over the next week, and I hope to see you next week when we'll do the summary of the last 3 months. Goodbye, keep safe, bye-bye.